The title of today's class is The Best Ways to Deal with Fibromyalgia by Dr. Conti and Dr. Nerenberg. About 2 to 4% of the population has fibromyalgia, and it's primarily women. The pain becomes excruciating. It's a chronic condition. It's diagnosed after the person's had the pain for at least 3 months. There's at least 18 tender points wherever you touch hurts, and it's spread throughout the body, throughout the 4 quadrants of the body. The pain is very severe. Some people find it hard to even move or do anything. You have others who just push themselves and get through the day and accomplish what they need to. Sometimes it's progressive and it gets worse over years. In many cases, it doesn't progress and it doesn't get worse. It detracts enormously from the quality of life. Anybody who has fibromyalgia or knows somebody with fibromyalgia knows how devastating this is. Fibromyalgia means pain of the muscles, tendons, and ligaments. Pain in the muscles, tendons, and ligaments. There are different ideas as to why this happens. One idea for some people, and keep in mind it may not be just one cause, it's probably multiple causes, and there's certainly multiple variables that exacerbate the condition. One cause is what's called mycoplasmal infection, and that responds to antibiotics. There's a chronic infection that goes on, and then they have to put antibiotics for 3 months to a year, and they change the antibiotics to prevent developing resistance. For some, there's an increase in sympathetic activity, a decreased blood flow also to parts of the brain. The one theory is, it's called a central sensitization theory, which is the brain of a fibromyalgia person is more sensitive to pain at a lower threshold. And that's because the brain became more sensitive due to an injury or an infection or stress. So the trigger for some could be a physical trauma, an infection, or stress. Stress will exacerbate fibromyalgia. It'll make it a lot worse. And then the fibromyalgia then produces stress. The person can't do what they used to do. They can't take care of the responsibilities that they want to take care of typically, and that makes it worse. Now, the treatments involve, the conventional treatments are antidepressants, physical therapy, some drugs like an antidepressants I mentioned, but also anticonvulsants. Lyrica is FDA approved. Therapy to reduce stress, acupuncture, massage, relaxation therapy, capsicum, which is made from the hot peppers, chili peppers, SAMe, which is capital S, capital A, capital M, small e, SAMe, 5-HTP. And typically in fibromyalgia, there's a problem sleeping. And melatonin is very good for that. Melatonin will help induce the sleep. Green tea, B vitamins, D, digestive enzymes. There is a problem typically with fibromyalgic people of having inflammation. So you want anti-inflammatories such as malic acid, curcumin. You want anti-inflammatories. And also a problem with absorption. They don't absorb the nutrients. So while they're eating, they may not be absorbing the nutrients. So at times they need to take massive doses of vitamins so that some of it makes it into the system. Exercise, reducing the stress, limiting overexertion, sleep, and learning how to pace yourself are important for any fibromyalgia individual. Typically, there's accompanying with it clinical depression, where the depression makes the fibromyalgia worse, the fibromyalgia makes the depression worse. So you have the malabsorption, you have the inflammation, and some of the nutrients that help are acidophilus, coenzyme Q10, lecithin, malic acid, which helps with the inflammation, vitamin A, B, and E. You want to have probiotics, garlic, MSM, grapeseed extract, magnesium, and proteins. And you want to be increasing the raw foods, like get up to 50%. Pomegranate's very good, lots of water, 4 to 5 small meals during the day, low in saturated fats, and typically have to eliminate caffeine, alcohol, sugar, dairy products, and white potatoes.